Okay, so this is the presentation over all of the topics we've learned so far in pediatric sonography. So we'll start with hydrocephalus. It's a buildup of fluid in the ventricles within the brain. It results from an imbalance between cerebral spinal fluid production and its drainage by the arachnoid villi. Schizencephaly is characterized by abnormal slits or clefts in the cerebral hemispheres of the brain. Those with clefts in both hemispheres tend to have developmental delays, such as speech, language skills, seizures, and problems with brain-spinal cord communication. Alobar holoprosencephaly. It's the most severe of this kind of disorder. It causes facial deformities. The brain surrounds a single midline horseshoe or crescent-shaped ventricle with surrounding thin cerebral cortex. The hemispheres are fused as a mass of tissue in the most anterior portion of the calvaria. Hashimoto thyroiditis. It's when the immune system attacks the thyroid gland. It's the inflammation of thyroid causes a leak resulting in hyperthyroidism. Eventually, inflammation causes hypothyroidism. Graves' disease. It's when the thyroid produces too many hormones, resulting in hyperthyroidism. Symptoms include anxiety, hard tremor, heat sensitivity, weight loss, puffy eyes, and enlarged thyroid gland. Thyroglossal duct cyst. It's a fluid-filled pocket in front of the neck. It's a cyst that forms from the development of the thyroid gland, and it commonly presents at birth. Spina bifida. It's a birth defect where the baby's spinal cord fails to develop properly. It's a midline defect of the vertebrae resulting in exposure of the contents of the neural canal. Intraspinal neuroblastoma. It's a solid cancerous tumor that begins in the nerve cells outside of the brain. It can start in the nerve tissue near the spine and the neck, chest, abdomen, or pelvis, but most often begins in the adrenal glands. Sacrococcygeal teratomas. They are the most common presacral tumor in the fetal or newborn period. It's a rare tumor that forms most commonly at the base of a baby's tailbone, but can form at other parts of the body, and it develops from the same type of cells that form the reproductive tissues. A pleural effusion. It's the buildup of fluid between the pleural tissues that line the lung and chest. Heart failure is the most common cause. A lung abscess. It appears as a complex collection of fluid, debris levels, and septations. It's a type of liquefactive necrosis of the lung tissue and formation of cavities, more than 2 centimeters, containing necrotic debris or fluid caused by microbial infection. Atelectasis. It's lung that is similar in echogenicity to the liver. It's complete or partial collapse of the entire lung or area or lobe of the lung. Developmental dysplasia of the hip, or DDH. It's a hip socket. When the hip socket is shallow, the head of the femur may slip in and out and possibly dislocate. Usually manifests in the first year of life. Subluxation. It's when the femoral head is displaced laterally, posteriorly, or both with respect to the acetabulum. It causes a slight misalignment of the vertebrae. Teratologic hip dislocation. It's dislocated early in utero. It's seen with various syndromes and neuromuscular diseases. It can be corrected with gentle manipulation at birth. Horseshoe kidney. The long axis of the kidney is abnormal. The lower poles are rotated medially and will be fused in the midline, anterior to the spine, by a fibrous band or renal parenchyma. UPJ obstruction. This results from a stricture at the UPJ or renal pelvis or a crossing lower pole renal vessel. Multicystic dysplastic kidney. It's the result of abnormal fetal development of the kidney. The kidney consists of irregular cysts of varying size, and the kidney has no function. Hemorrhagic ovarian cysts. It's an adnexal mass formed because of the occurrence of bleeding into a follicular or corpus luteum cyst. Dysgermanoa. It's a large, solid, encapsulated, rapidly growing ovarian mass containing hypoechoic areas as a result of hemorrhage, necrosis, and cystic degeneration. Granulosa theca cell tumor. They commonly produce estrogen that is higher than usual. They're almost always benign, and the most common symptom is early puberty. Epididymitis. It's inflammation of the epididymis. The swelling can cause intense pain in the testicle. Orchitis is inflammation of one or both testicles. It most often is the result of bacterial infections, such as a sexually transmitted infection, and occasionally the mumps virus can cause this as well. Varicoceles are dilated veins in the pampiniform plexus, positioned posterior to the testes. Choledochosis, it's dilation of the common bile duct, clinically mimicking neonatal hepatitis and biliary atresia. The bile may back up into the liver. Caroli disease is the choledochosis type 5. It affects the intrahepatic bile ducts. It's non-obstruction dilation. Dilation of the intrahepatic bile ducts can cause bile stones to form, which can then lead to jaundice and flu-like symptoms. Neonatal hepatitis is inflammation of the liver that occurs in early infancy, typically before 3 months. Some are infected by a virus that caused the inflammation before birth by their mother or shortly after birth. Polysplenia syndrome, associated with 2 or more multiple spleens with multiple congenital abnormalities in the abdomen and chest. It can be a single bilobed spleen or a single normal splenic gland. Splenic enlargement, or also called splenomegaly, is enlargement of the spleen. Common symptom is feeling of pain or discomfort in the upper left side of the abdomen or upper left upper quadrant, usually caused by systemic infections. And then splenic hematoma. It's hypoechoic lesions often located under the capsule. It's usually a result from abdominal trauma or clotting disorders, or can occur in association with splenic neoplasia. It can be seen intraparenchymal, subcapsular. It also may be seen adjacent to the spleen. Gastric ulcers. They're a localized area of erosion in the stomach lining, resulting in abdominal pain and possible bleeding. They're more common than duodenal ulcers in younger children. Duodenal atresia. It's congenital absence or complete closure of a portion of the lumen of the duodenum. Causes polyhydramnios during pregnancy and intestinal obstruction in newborn babies. And finally, intussusception, which is part of the intestine, kaleidoscopes into another portion, blocking food or fluid from passing through. Also cuts off the blood supply to the part of the intestine that's affected. Most common cause of small bowel obstruction. And that concludes my presentation. Thank you.